to Gyan Pravah, the 176th episode of this fantastic podcast series started by our beloved President, Dr. Sunita Tandulwadkar. Madam, this year is indeed a roller coaster ride for you and along with you, all of us. I think it is an academic, social, and spiritual, tour, excursion, expedition that you have set out on. And I think even Everest seems to be smaller than your aims and your goals. So we're indeed blessed to be led by you, and we are blessed to be a part of this Gyan Pravaha podcast series. So over to you, madam, for your words.
Thank you, Charu. Thank you. 176 is one of the, rarest dream come true.
Right.
Dr. Mayaji, thank you so much for coming on a Foxy platform. Charu, thank you for having personality like Dr. Maya Tulpule, madam.
Yes.
So these are the podcast every day. So today is the 22nd. So every month, 22nd, Charu comes with some faculty, maybe academic, non-academic, any inspirational faculty. And then we have a dialogue. And believe me, with meeting 176 faculty, I think it evolved me as a person. I got connected with hundreds of faculty, these leaders from global Pratt, meeting them, getting introduced to them, having dialogue with them. It was enriching experience. I know we all run very busy life when you are Foxy president, but every day 8 p.m. commitment, it was a huge task, and we all, including my chairperson, used to say how you will do it. But then once you decide you do it, that's how it is. And I'm so thankful to all my 30 committee chairperson, Charu and all, that they come out with brilliant. Their broadcast is better than their previous. They never bother about others. They just concentrate on this. Today gets over, tomorrow she will start thinking who will be my next. And then they start designing, depending upon the personality, how their podcast should go and how it will interact and how it will attract many more people. So this is a fantastic journey. And Charu, your yatra from Kashmir to Kanyakumari, those who don't know, it's a beautiful concept which we curated together. And from Kashmir, we started our yatra. And this weekend in Kanyakumari, we are going to end again the passion of Charu for doing this so sincerely, so religiously, and going through various societies on the path from Kashmir to Kanyakumari is one of the memorable event of my tenure, I must say, and maybe in Charu's 3 years journey as well.
Definitely. Thank you so much for all those kind words of praise, ma'am. But you are our source of inspiration, and we really try to follow you at least in an iota, because your work, your energy, your level of commitment is way beyond what any of us have ever seen, witnessed, or even dreamt to have been doing. So we are very thankful to get this opportunity to be a part of Gyan Pravaha. And today's guest for our evening podcast is Dr. Maya Tulpure. The name of our podcast is Vitiligo, not just skin deep. I think Dr. Maya Tripure is known for her multifaceted personality. She trained as an anesthetist, then she trained as a surgeon. But I think the name, fame, popularity, and basically she blossomed when she became the founder president of Shweta Foundation, which is working for vitiligo. I think that leprosy is now getting eradicated. But these kind of social stigmas like vitiligo, they leave a deep mark not only on the skin, but on the mind, on the heart, and on so many other things of people. And to work for this kind of a community is a very, very rare phenomenon. And Dr. Maya Tulpure has been doing it. I'm so glad to have you, Dr. Maya, as a guest today. Thank you for sparing your valuable time. And thank you, Dr. Sunita, madam, for giving this valuable opportunity to me.
Thank
I
you.
thank Fogji and Dr. Tandulwadkar and of course Dr. Gyan Pravah to give me this occasion to be with you.
Thank you. Thank you, Mayaji. And our protocol is you and Charu will be having the dialogue, and I will be joining the viewers link so that the country will see both the personalities together. and we will enjoy the podcast from other link. Thank you.
Oh, thank you. Thank you.
Thank you so much, ma'am. Thank you. Thank you for your blessings and kind words. Thank you. So now over to you, Dr. Maya, madam. I think, we all have seen founder presidents or seen directors of, maybe an academic organization, of a banking organization, or organizations like Rotary and so many else. But an organization for vitiligo, probably I have never come across anybody who's the founder president of an organization for vitiligo. So, Dr. Maya, this different path that you took, this different path that you treated, how did it happen? How did you get into this, and how did you decide to establish Shweta Foundation and this foundation for vitiligo people?
Yeah. The story goes back 60 years back. I was 10 years old and I had vitiligo. But most of it disappeared as soon as it came. I was very determined and I accepted it. And I had very good family support. So the time when I went to medical education, then I came to know that this is vitiligo. Nobody in my near family or extended family ever said that you have vitiligo or they discriminated me. I had no problem for education, for marriage, and my both children are very good, well settled.
Yes, they are. They are.
And they do not have vitiligo. So I thought that why not help those who are not so fortunate like me?
Yes. Because I think most
And
people suffering from vitiligo, it's pronounced as vitiligo, is it?
yeah,
All right. Because most people suffering from vitiligo will be suffering from so much of mental and social trauma. They face so many difficulties. And you are one of the fortunate few who did not have to face any of this. But in spite of that, you're deciding to work for them. That is creditable, ma'am.
the turning point was in 2000. I went to USA. That time I was totally depigmented, and I mean like this. And when I went to US, everybody was like me. And I was traveling there for almost 2 months. And then I said, oh, in one part of continent, there is no stigma, nobody discriminates, nobody looks twice at you. And why so much stigma and discrimination in our country?
Right.
And then within 2 months, I started this self-help support group, Shweta Association.
Wow, that is really creditable. Yes, I think that looks are important, definitely. But in our country, whether it is a mentally challenged child or a slightly deformed person or somebody having vitiligo or, they're albinos where they're completely white, all of them get very strange looks and they are not accepted by the community. So, what is the exact role that the Shweta Foundation plays for vitiligo people?
Basically, we bring together on same platform at the Shweta Association. Then basically we share and care. That gives lot of vent up of their emotions. Then gradually people started saying that no, we have other difficulties in life also, like marriage, a big hurdle, especially for girls. Then employment, education, they are discriminated at employment, and all front desk jobs are denied, who will cast them as an actress or air hostess or a receptionist, model, everything. So people are not aware about the disease. They still think that it is contagious, harmful. So advocacy is our main aim, to educate the society as well as the person who has vitiligo.
Right.
So,
So
then there are
is it actually a disease? Is it actually a disease or what is it? What is vitiligo?
It is an autoimmune disorder, just like thyroid or type 1 diabetes or alopecia. You
Okay.
know, yeah, it is not at the birth. It is not. It is acquired in later life. It is non-contagious,
Okay.
and nobody dies of vitiligo. That is
Sorry.
the biggest issue. You have to live with vitiligo.
Oh, there is no complete cure for it.
No, no, not yet. Maybe
Okay.
up to 50% with the recent development in the treatment modalities.
Okay. But madam, does it does it move ahead in through the generation? Like if your mother has vitiligo, will you get vitiligo?
See, all over world, percentage of vitiligo is 1%.
Okay.
Maybe 4 or 5 times more they can get it.
Okay.
But we do not know any single gene. We don't know how it is transmitted. It is supposed to be autosomal dominant, incomplete penetration, multifactorial, and not necessarily that you will transmit it to your children.
Okay. So it is not 100% going to be transmitted. I think, and there are some
No,
there are triggering factors also, I suppose, because of which you can get vitiligo, right?
yeah. Stress is the biggest factor. Many,
Absolutely.
it can be mental or physical. People
Right.
get after some illness or something. But there is an inherent tendency to develop it somewhere.
Right.
Not everybody who is very sick develops vitiligo. So we are not yet aware of what this inherent tendency or how we can find it out that who is having this tendency and will have it.
Right. So it is a very less understood problem. And
Yeah.
do people suffering from vitiligo suffer from, are they more prone to some heart problems, or they're more prone to kidney problems or liver problems? Is that it?
Not at all.
Oh,
Only sunburns is the only factor because melanin protects our skin from the sun rays. So when melanin is absent, you get sunburns. That is the only thing they can have. Recently, we got one paper where they say that if you have vitiligo, uh, chances of carcinoma colon, skin cancers, or melanomas are very less, almost nil.
is that so?
Yeah.
Interesting to note that. My goodness. Okay,
Yeah.
that's interesting. So what goes wrong when you get vitiligo? Like, what is the problem? Like, is there a problem with the melanin production, or what goes wrong when
Yes.
someone gets
Our
vitiligo?
our skin color, hair color is due to a pigment melanin, which
Right.
is produced by melanocyte, and melanocytes are situated in the deeper layer of the skin, and they are derived from ectoderm, so they have neural origin. They once they die, they cannot be reproduced.
Oh,
And one melanocyte gives pigment to almost 36 skin cells.
okay, okay,
So, see, when you get older, you lose melanin in your hair.
right. So your hair
Similarly,
becomes white.
yeah, but that is
Okay,
a natural process because those melanocytes die. But
okay.
the melanocytes in the skin, they do not usually die like that. So
Right.
that's why there is stigma.
Oh my goodness, that is perfectly said. Absolutely rightly said. So your body produces antibodies to the melanocytes, and the melanocytes in your skin die.
Yes,
And why exactly they produce is still rather unknown.
not known. Yeah.
Absolutely. So I think that it must be quite traumatizing. You said that you got it at the age of 10. And, when at that age, you're growing, you're blossoming into a lady. And then, to see those patches appear on your skin, it can be very disturbing, especially when you look at yourself in the mirror and
Yeah.
see those patches on your body. And do they itch occasionally, madam? Or no, there is no itching, nothing.
Not at all. That
Okay,
they are very innocuous, no harm, except
okay, okay,
sun. Yeah.
okay, okay, okay. But then how did you handle that burden, that trauma that you were developing vitiligo?
Yeah. Basically, I was a tomboy and nothing was happened. I did not have even headache, fever, nothing. So I didn't bother. And those times looks were not, I mean, we never used to look into the mirror all the time at the age of 9 or 10. Uh, and they got quickly cured, except for one or two on my legs.
Okay.
So most of the people didn't know that I have vitiligo, but that
Okay.
is more stressful because you tend to hide it, and
Yeah.
you always feel that someone might discover it, and they will discriminate you.
Okay. So then you used to wear long clothings or something like that, or what
Oh
were you?
yeah, yeah, long skirts and everything.
Okay, okay, okay. But now in your Shweta Foundation, you not all must be as fortunate as you, where you got so much of family support, where almost in a month's time you turned completely white, and you did not have the variegated appearance, which is the most traumatic probably. And then how do all these other vitiligo people cope up with these problems, or what does Shweta Foundation do to help these individuals who develop vitiligo for their
Our
emotional
main
well-being?
counseling,
Okay, okay.
and it is on in three tiers, like it is personal or group counseling, or if the case is very severe, people are very much in depression, we send them to psychologist, and sometimes the psychiatric treatment is also needed.
Yes, I suppose so. I suppose so.
Yeah,
Right.
right. And personal and group discussions are most welcome, you know. Like in a group of 10 people, we employ one person who has overcome the vitiligo emotions. And I will just quote one incident that in a lady
I'm sorry. I'm sorry. Sorry. I'm sorry. Sorry.
Yeah. So one lady said, who was trainer, that I was a sister in UK, and I was always swimming wearing bikini and all. And one our little girl, she said, "Mama, you have stopped my swimming because of vitiligo. Now I will go." So
Oh,
little incidences, but they are turning points in their lives.
so true, madam. Absolutely rightly said. And do you think, when we were just discussing about this, you mentioned that it also serves as a marriage platform, the Shweta Foundation, for these vitiligo people. So, do you think that these people tend to marry only each other, or they get partners who do not have the problem, or how does it work?
Yeah, to begin with, we were very particular to find out someone who is who will marry a non-vitiligo people. But after some time, our members said that anything, like one girl married a person having polio. It was not major, minor,
Okay.
but she said still, polio doesn't have stigma. Like they have sympathy. Oh, this is crippled man. But vitiligo has no sympathy. So she said, no, everybody, even in my husband's eyes, sometimes I see that discrimination.
Oh my God.
So many times they prefer to marry a person having vitiligo.
Okay. Okay. I get it. So
But,
yeah, it is.
but we have three categories,
Yeah.
like boys and girls who are having vitiligo. Then even someone in the family, they get difficulties in marriage. So that is one category. And now young generation is coming up. They have very broad mind, and they say, okay, we don't mind marrying a boy having vitiligo or girl having vitiligo.
Okay, okay, that is interesting to know, and it is heartening to know also that that society is changing slowly but steadily. And I think that you have been a pioneer for this change because you were so selfless and passionate about the Shweta Foundation and working for vitiligo people. That from a person who trained to be an anesthetist, is a fantastic surgeon, you decided to go behind the camera and become a producer. And you produced a beautiful
Yeah.
movie by the name of Nitar. So Nitar is a Marathi word for clean, clear, pure, which can be nitar pani, which is the clear water, or it can be a nitar skin, which is your clear skin, or it can be a nitar mind, a clear heart. Maya Madam is a mixture of all of this. And she went ahead and produced this movie by the name of Nitar. I think that it was a landmark movie. It was way beyond its time. The message that it gave to people about vitiligo was immense. And I think that to our viewers, we must tell them that they can find the link for the same on YouTube, and they really must watch it because it is a turning point. It is a fantastic movie. And Maya ma'am, I want you to share with us about this journey of Nitar. How did you go about it? What made you make it first and foremost? It's not easy. You're a surgeon, you're operating, you're running a hospital, and then, to produce a movie, and that too on vitiligo, which nobody has ever done up till now. What
Yes.
motivated you?
Yeah, let me tell you, Shweta Association is the first organization in India, self-help support group for vitiligo. No,
Big
no,
round of
no
applause
such
for
big
that.
organization
Big round of applause.
in India. And Nita is also, as you said, a benchmark. You had a role in that movie also.
Absolutely, yes. Most
The
definitely.
idea was World Health Organization declared leprosy as eradicated in India in the year 2005. So the next disease or disorder having highest social stigma was vitiligo because it is visible and there is stigma attached to it. It so
Right.
happened that I watched a movie by Sumitra Bhave on uh, mental disorder, schizophrenia,
Okay.
and she depicted it so well. I really liked it. The movie was Devrai, and then and there I decided to produce this movie. And to begin with, I sold a lot of my properties for that movie because it is not a small job.
True.
And 80% of the inputs are by me and Shweta members. Even the makeup for makeup, and they didn't know how to do a makeup. They were just doing round patches. But our 8 girls, they sat as a model, and then we typed how to do it and all those things.
True. So true.
So, yeah.
It's beautiful. I mean, I think that the way there is this surgeon girl who has vitiligo, and the young man who falls in love with her, and when she looks at her hands and says that it is increasing, I'm getting tears in my eyes. She is talking about the vitiligo, but the young man who's in love with her says, yes, the skill in your hand is increasing. And if you can really have people like this who can see the person inside that skin, and who can see the heart and the skill and the knowledge inside that particular person, and not judge the person by the skin, I mean, the world would be a much, much, much more beautiful place.
Yes.
And this message that you spread, madam, it really touched each and everyone's heart. And the message that it gave everybody, I think you won so many awards for it, Maya ma'am.
Yes, yes, almost all ours. Because this topic was not handled, and the story was very good. Like I said, family acceptance. That's why in the movie they have shown 3 generations. So
Yeah,
all our inputs were depicted very nicely in the movie.
right.
So yeah, we are thankful to Smita and Sunil for
Sure.
that.
I'm sure, absolutely. And considering that leprosy is now almost eradicated, this seems to be really one of the biggest social stigmas of today. And yes, it needs to be looked into. It needs to be targeted, and there have to be more foundations like the Shweta Foundation. Everybody has to join hands and stop looking at these people with vitiligo as somebody with some dreadful disease, and where we are not even going to speak with these people or interact with these kind of people. But madam, like, is there any treatment? Is there any treatment for vitiligo?
Yes, yes.
Like, suppose,
You
like, you
know,
have a young girl, and she just sees one patch which has appeared, and then should she visit a dermatologist? Should she visit a physician? Should she visit an autoimmune person? Whom should she be visiting, and can she
no,
do anything about it?
visiting dermatologist is the best thing.
Okay,
As soon as, I mean, the earlier you start the treatment, the best results you get.
okay,
Especially in children, we get very good results.
okay.
Treatment is in the form of medication. If the disease is spreading very fast, they give some steroids or autoimmune treatment.
Okay,
Then any like thyroid diabetes, you should get cured, I mean, under control. Then topical ointments are there.
okay,
Uh, for last 5,000 years, Ayurveda knew that Bauchi plant extracts are very good.
okay,
So soralins are isolated from Bauchi plant, and even they are used today after 5,000 years. Then
okay.
there is calcineurin. The most good ointment is tacrolimus. Nowadays there are JAK inhibitors, which are very costly but very good. And when the patches are steady for a year or two, you can do skin grafting, and now recently even melanocyte transplant.
Oh my God. So there is progress in this field, and things are looking brighter for these people. But for somebody who cannot afford all these things, can they just do something to their skin, or can they get some help with makeup, or some, you know, uh,
Oh, it is known as cosmetic camouflage.
okay,
And in all over Europe, this is the most sort of the treatment, no, not treatment, but makeups, and they have makeup sessions. So you can conceal. The thing is just like a foundation. And I will tell you, this foundation is used by most of the actresses also to
oh,
hide their acne scars or something. It is very safe. And
okay,
a lot of research is also going on that whether, because you have to remove that makeup after 12 hours or something.
correct, ma'am.
Uh, yeah, but long lasting, like for 8 days or something, makeup, the things are coming up like that. A lot of research is going on.
Okay, interesting. So yeah, there is so much new happening, and it's so nice to interact with you, Maya madam, and understand this particular problem, or this particular stigma, and try to get it out of our system per se. And now moving to your other facets, ma'am, you're such a multifaceted personality, that you first trained to be an anesthetist, and then you trained to be a surgeon. And I know that you've been running a fantastic hospital single-handedly for so many days. So
Yeah,
for so many years, I should say, not
yeah.
days. Madam, how has your academic journey been? How has this professional journey been? And
Mm.
did you want to always be a surgeon? And how did the whole thing happen?
Yes, surgery is my passion, and it is my dream. If ever I get next birth, I would like to be a surgeon.
Oh, interesting.
Yeah, and this Shweta Association, everything is incidental. It is not like passion. It is out of necessity and need of the people in India. And I think being a surgeon, I have that courage. Who will come forward and say, "Oh, I have vitiligo," when it is so much stigmatized?
Right. I think that is very well said, ma'am. We all know that surgeons are really brave people. And whenever we are stuck in the OT, we always call the surgeon. Once the surgeon is here, he have a sigh of relief. And I think that bravery definitely must have played a role
Yeah.
for you to step forward, because I know so many people who suffer from diseases or disorders, sometimes breast cancer, any other cancer, but they find it difficult to come forward and say that, okay, I had this, and I'm going to go out and tell people how to prevent this or how to diagnose it early. But it is really hats off to you, Maya ma'am, that you took this courageous step to step forward and help so many other people. So yes, about being a surgeon, ma'am.
Yes. Yeah. Sometimes I feel that being a lady, I had some family restrictions, children and everything. But otherwise, maybe. Yeah.
Yeah, that
And
can be
yeah,
incidents.
yeah. But I'm a passionate surgeon. Anything can.
Right, right, absolutely. So I think that it's nice to know that you want to become a surgeon once again. And you didn't stop only there. You went ahead and became the IMA Pune branch president also.
Yes.
I mean, your journey for social work, for organization, just shows that you have such immense organization skills. You have so much passion for social work, and that you want to keep doing more and more to help society. So, how was your journey, or where did the journey of the IMA Pune begin?
Oh
And what
yeah.
were the important, or what were some important incidences or happenings or occurrences during that phase?
Oh yeah. Yeah. I think I'm a long time IMA Pune member, but I was not very active. After producing Mithar, we made one show in IMA, and Dr. Vaijanti Patwardhan, she's a gynecologist.
Yes,
She
yes.
was IMA president then. Then she just told me, "You come to IMA and work for IMA." And then
Oh,
being a passionate worker, where if you work really nice, nobody discriminates you whether you have vitiligo or not.
oh,
So yeah, and I was always fond of social work, and this gave me a broader platform for that. We worked very much. I remember secretary when H1N1 swine flu epidemic came up,
uh-huh.
and we do a lot of work because nobody knew what is swine flu. And Pune had maximum deaths and maximum number of patients in India. So we even published a book on first-hand experiences on swine flu.
Okay.
And my tenure, I organized so many conferences and events like GPCon, Inter-District IMA Conference, IMA State Conference, EVES Conference for ladies, then
Oh,
Mastekon for Maharashtra State Diabetes Special Conference, sports events. Then I was editor of IMA Plus for so many years, and
yes.
lot of camps like there is IMA camp in Gauchale, then Warkari health checkup, journalist health checkup, cervical cancer screening with one of the gynecologist, Dr. Joshi, then diabetic food, then awareness of women health, especially cancers in women, how we can prevent them, then
Right.
yoga, and so many more things I could do.
Wow, wow. I think that is amazing that when you have these beautiful platforms like the Foxy platform or like the IMA platform, and as you rightly said, if you're willing to work, then sky is the limit, and you can
Yeah.
do everything. I think that people of today now we only know about COVID, and swine flu is a little in the yesteryears, but that time it must have been the first of its kind epidemic,
Oh
and
yes.
as you rightly said, there were so many deaths occurring at that time, and nobody knew how to cope up with them, how to handle them. So you must have had quite a big task at your hand. So I think that was really, it is satisfying also that when you really work so much for the society, and you can see the praise in their eyes or the thanks in their smile, or when the patient gets better and goes home, it is really such a beautiful feeling. So, madam, when your work demands a lot of accolades, and I'm sure that you received a lot of recognition from everywhere. So, any awards or any recognitions that you think really touched your heart, that made you feel good?
Yeah, my first award was Shantabai Kirloskar Award for an outstanding lady surgeon.
Okay. I think in
Then
those
there
days
are
for a
many,
lady to
but
be a
I
surgeon,
will I will
yeah.
mention only few. Dr. Anita Outsat Smriti Sangarsha Puraskar by Muktangan. Then Manav Seva Dharma Puraskar from Chennai, Baya Karve Puraskar. that is a very prestigious by Maharshi Karve Sanstha,
Right.
Anandibai Joshi Puraskar, and many more. Yeah, but
Oh, wonderful, madam. So it is very heartening when your work gets recognized and you get praised for it, then it gives you inspiration to do more and much more. So now, what is your next in line? Because a person like you cannot sit quiet, I'm sure, and I'm sure you must be, something new must be brewing in your mind, and you must be wanting to do something bigger, better.
yeah.
So, can we ask you what is your next
Now
project?
we are focusing on adolescents and young children and boys and girls. So we will soon come up with a short film on adolescents, of course, with vitiligo.
Okay.
Then, yeah, I wish to network. Like I want to found many our branches or maybe patient organizations for vitiligo in India,
Yes, I
because
think it
there's
is
a lot
necessary.
of apathy and nobody wants to come forward and start it. But
I
recently at Jodhpur AIMS, the one branch will come up. I visited Jodhpur recently.
okay.
And I don't know why there is so much apathy in the mind of a person who is having vitiligo. It is very sad.
I agree.
Find it. But yes, globally there is a lot of appreciation and people come up. Even online surveys, nobody wish to participate. It is very disheartening. But yes, I am one of the founders of Global Skin Foundation from Ottawa, Canada. There
Okay.
are about more than 300 patient support group leaders who are members, and I am vice president. I was elected recently.
Wow.
Then,
Congratulations, madam.
yeah, thank you. Then there is Vitiligo International Patient Organization at Paris. So I am a founder member and vice president of Southeast Asia Zone. Then, of course, Vitiligo Foundation of India was formed 2 years back, and I'm a patient liaison committee chairman. Then there is one Global Vitiligo Foundation from USA. I'm a member, and also Vitiligo Research Foundation from USA. I am member of that also.
Oh my
So,
God. You are so committed to the cause, madam. You're so committed to the cause, and globally, you're representing India at all these places, and it is indeed a matter of pride for us. And I think that if Dr. Tandulwadkar hadn't given me this opportunity, I wouldn't have known that somebody so close to me, somebody from my city of Pune, is doing so much for vitiligo all across the world. So I think this wonderful platform that has been provided is really fantastic, and I'm so glad to know all these new things about you, Maya ma'am. That
one more thing. Nowadays, phototherapy is supposed to be a best treatment.
oh, is that so?
Therapy is just ultraviolet B rays, sun rays to be given in a calculated manner.
Okay,
You most of the times you need not take anything by mouth, no oral treatment, just tacrolimus ointment and this rays twice a week,
okay,
and that gives 60% or 65% repigmentation in the people having vitiligo.
okay. I'm
But
happy to
there
hear
is
that. Yeah.
fatigue all over, even in health departments. When I approach them that you set up such centers, they say, "Oh, vitiligo, no, it doesn't disable you, it doesn't kill you. You are not handicapped. Why we should help you?"
Oh my goodness. Okay.
So I have set up 10 such phototherapy centers at
Oh,
a very reasonable cost, maybe less than the government or hospitals all
oh,
over Maharashtra. And they are doing very well, even in Naxalite area of Bhandara or Vai, where there is no treatment or things like that. 10 centers I have established till now.
congratulations, madam. Indeed, another feather in your cap and another achievement. And I think, yeah, you are unstoppable and you are just going all out to do whatever best you can for these people suffering from vitiligo. And so, before we end, we would just like to have uh, what message would you want to give all of us, especially the youngsters of today? What do you
Yeah.
think you want to tell
Yeah.
them?
Yes. Uh, I must tell everyone that your skin is not you. Skin is not everything. Though it is the most visible part of you and largest organ of the body, but skin is not you. You are beyond that. And so you should love your body. Don't hate that I have this or I have that. No, you should love your body, love yourself. And I always tell my girls and boys that you develop skill, you do something else that people won't look at your skin, but they will look at your virtue as a person, as an expert in your field. Get educated, get employed, because when you are financially independent, it makes a lot of difference in life, especially in marriages and everywhere. You should be independent. So, and accept it. Don't tell every time that why me, nobody in my family is having this, that. Okay, it's there. So what? So what? Overcome it.
Fine.
So your quality of life will be good.
I love that sentence of yours, that love yourself, and that beauty is not just skin deep. And oh, such a beautiful message, Maya madam. Indeed, it is a great pleasure interacting with you. So much to know about you and your Shweta Foundation, the immense work that you've been doing for Vitiligo, and your courage to stand up and say that yes, I have this problem and I'm going to help others who have this problem. So, once again, Maya ma'am, thank you so much for sparing your valuable time and coming for our Gyan Pravah podcast, a podcast series started by Dr. Sunita Tandulwadkar, President Fogsi. Thank you very much, Maya ma'am. And I cannot end the
Yeah.
podcast without thanking our support team for having made all the logistical arrangements. Thank you so much. Thank you.
Thank you.